You're watching the Isaiah Factor, Uncensored.
And welcome to the second half of The Factor Uncensored. A mother-daughter duo have been arrested and charged with murder after a woman died from complications from her Brazilian butt lift she got at the woman's house. Why are so many people willing to go through shady dealings to get the look they want? It's a problem we're seeing all over this country, and we're seeing deadly results. We talked to a plastic surgeon about the problem. And joining us now here on The Factor Uncensored is Dr. David SHAFER, and he is a certified plastic surgeon. Dr. SHAFER, we have seen cases all across this country where individuals, in order to save money, put their lives at risk with botched, bootleg plastic surgery out there. It's just mind-blowing what people will do to save a buck.
It's really unfortunate because people try to save money or cut corners, and you're really risking your life and your safety when you're doing that.
Well, we have seen in a case in Los Angeles where a mother and daughter have been charged because someone is now dead. It can get that dangerous.
You know, the Brazilian butt lift and injections in the butt are the most dangerous plastic surgery that you can have, even in the best hands. So when you're going to somebody who's doing a procedure in their basement or in their kitchen and using industrial grade products instead of medical grade products, it's really very dangerous. It's very serious, and you really have to think about what you're doing when you go into those types of situations.
And when people think about, say, a butt lift or the Brazilian butt lift, they're thinking, well, it's just my butt. It's not going to kill me. I'm not going to die from my butt. But what are the dangerous factors in a procedure like that could kill you?
The underlying anatomy is very important, and only a board-certified plastic surgeon really has an intimate understanding of that anatomy. But there's important blood vessels right underneath of the skin, and if the products are accidentally injected into those blood vessels, it can travel to your heart or to your lungs or to your kidneys and can kill you right away. You can have a stroke, you can have other issues, and it's really a very dangerous situation to be in when you have somebody who doesn't know the anatomy. They don't know sterile technique, they're not using the proper products, and it puts you in a very important life-threatening situation.
Dr. SHAFER, even if it looks like a legitimate business, you would not go there if what's not in place to get this plastic surgery or procedure. What are we looking for to avoid any type of procedure? It can be fancy, but if who's not there, if what's not there, you wouldn't use it.
It's very important to find out who is doing the injections or the treatment. You want to make sure it's a board-certified plastic surgeon by the American Board of Plastic Surgery. There's other names that sound similar that are deceiving to the patient, but you want to make sure it's a board-certified plastic surgeon. You also want to make sure it's a legitimate medical practice. So if you're going into somebody's living room or basement, that's not a place to have a medical procedure. The other thing you want to do is talk to the other people who are in the waiting room. Talk to the people who are there. Make sure you feel comfortable with them. You need to make sure that you're meeting the doctor and that it's actually a doctor doing the procedure. If you're not knowing what the price is, who the doctor is, who's injecting, and it seems suspicious, there's probably something wrong with the situation. And I'd get out of that situation and rethink what you're doing and start on another day in a legitimate facility.
Have you had to do any corrective surgeries for those who went for the cheapest price? And we know there's a lot of medical tourism out there, and people leave the country hoping to save a few bucks, and then they come back here and have to spend even more.
It's a very common situation. We have a lot of people that go to other countries looking to save money, and they have procedures or they have injections, and then they come back here with terrible infections or terrible complications, which require going back to the operating room, doing more surgery, and the people end up spending way more money than they would have if they just had the right procedure done by the right person originally, instead of going and looking for discount plastic surgery or other treatments.
Do you think there should be any legislative change in this country to address this? Obviously, it's a free market. People can spend their money where they want to, but should there be policies and procedures, maybe even laws, God forbid, to address this in the country, because people are dying?
I think people need to be held to account, and in this case, they are charging those two people with murder because basically that's what they did. They were impersonating a doctor, and the person ended up dying. But there definitely needs to be standards, and I think there needs to be more education for patients so that they can know the difference between a board-certified surgeon and somebody who's pretending to be a surgeon. There's some responsibility for the patient to make sure that they're looking for the right qualifications for a person, but there also has to be laws in place so that people can't use deceptive marketing to entice these patients to come in when they're not qualified to be performing the procedures.
You're absolutely right, because you're putting your life on the line to save a few dollars. Dr. SHAFER, for those who would like more information about you, where can they find out about you?
Sure. So my name's Dr. David SHAFER. I'm in New York City. You can go to shaferclinic.com and look us up. We have a clinic that involves plastic surgery, dermatology, laser. We do primary plastic surgery, but also corrective surgery for people just in a situation like this.
All right, Dr. SHAFER, thank you for joining us here on The Factor Uncensored. We appreciate your expertise and your advice, sir.
Thanks for having me. Have a great night.
Up next here on The Factor Uncensored, you've heard the people say, I need to do more research before I take that vaccine. They don't want a mask and they don't want a vaccine. So how in the hell can they stay safe in this pandemic? We have an alternative coming your way right here on The Factor Uncensored. Stay with us. And welcome back to The Factor Uncensored. There are a lot of people out there who still simply do not believe in the COVID-19 vaccine or wearing a face covering. So what are some of the alternatives to keep those people protected and safe? That's our goal here on The Factor Uncensored. So we talked to an expert about that. You can simply pop a pill tonight. Take a look. And joining us now here on The Factor Uncensored is Dr. Anjanette Wyatt. She's the CEO of Clinical Care Pharmacy. Glad to have you on The Factor Uncensored. Dr. Wyatt, we know we've been struggling, we've been pushing, we've been fighting with people who refuse to accept the vaccine. So we want to keep them alive, and we want to come up with alternatives that at least will keep and build up their immune system. So what are some options out there for those who are still hesitant and want to do more research? I don't know what hell research they're looking for, but what can we tell them as far as building their immune system to keep them healthy and alive?
Well, there are quite a few vitamins out there that they can supplement and take to boost their immune system. What we want is to get the immune system kind of ready for battle, and some of the over-the-counter medications can do just that. And a lot of them out there have to be taken daily to make sure you increase that probability and possibility of, if you are exposed to COVID, that your body's able to fight it.
Now let's take a look at some examples of some of the vitamins that are out there and supplements that we should be taking in order to bolster our immune system.
Well, the first, I have a few here. I'm not endorsing any of these brands, but definitely vitamin C. You want to take vitamin C. So vitamin C boosts the immune system, and we all know that, but having it on board during the pandemic is really, really important. Pretty much you can get the 500 milligrams and take it twice a day for 1,000 milligrams. I do a little more, even though it's recommended 1,000 at maximum 1,000, but just make sure you have at least 1,000 milligram on board daily for vitamin C. Then of course, even in the hospital, they give zinc. Zinc is very important for the body. It enhances the vitamin C and make it even higher in terms of immunity. We also have a multivitamin. I take this one, but a multivitamin. Everyone needs a multivitamin that have
the old school one a day. Remember that?
One a day, old school one a day. Go back to old school. OG works here. And then you want one of the most important ones you want is D. Because D, actually, there are studies out there that show that, especially for those of color, individuals of color, it shows that if you increase the level of D in your body to a large dose, well over 40, then you will have there's less likelihood of you testing positive for COVID. Now that's a huge. put vitamin D. This is 10,000 international units. A lot of times on the shelf, you'll see 1,000, 2,000, but you can order this if you don't see it at your local store. It is 10,000. Let me put it right way. 10,000 international units, one a day.
Damn, 10,000.
Well, let me tell you this. When you get a prescription, when we get prescriptions for vitamin D deficient patients, it's 80,000 a week. So it's okay to take that much vitamin D. And for those who have dark color skin, they need that to fight COVID.
And a few others Dr. Wyatt is recommending, so make sure you write these down. Turmeric and ginger, vitamin B, vitamin E, and omega fish oils can all help you with your immune system and keeping it strong. No matter what, just try to stay safe out there, folks.